retinopathy of prematurity, which we abbreviate as ROP, is, in simple terms, the abnormal growth of vessels, blood vessels in the retina of preterm babies. About 50,000 babies worldwide become blind due to ROP in the entire year. The problem with the blindness caused by retinopathy of prematurity is that it's irreversible. Meaning if it has blinded you, really if it has reached stage 5, you're blind for the whole life. Retinopathy of prematurity has varying prevalences in different countries across the whole world, from as low as 6% to as high as 70%, depending where in the world you are. Uganda, the very first study of ROP is that one I did last year between August and October in Kawempe National Referral Hospital and Mulago Specialized Women and Neonatal Hospital. The prevalence was about 18% in Mulago and 0.4 in Kawempe, but a total percentage of about 6% prevalence. There are some risk factors of retinopathy of prematurity. The younger the baby is born, that's the gestational age, that increases the chance of this baby having retinopathy of prematurity. The lower the birth weight, especially lower than 1,500 grams or 1.5 kilograms. And the gestation age, especially less than 32 weeks of gestation age. And also if a baby has neonatal sepsis, or what people could call infection during that time. If a baby is also transfused with blood during that time of neonatal care. Also if a baby has bleeding in the brain, which we call intraventricular hemorrhage. Also if a baby has what people call a hole in the heart, that is patent ductus arteriosus. Those are risk factors for a baby getting retinopathy of prematurity. And oxygen. Oxygen, the most risky bit in the oxygen is oxygen that is not blended, which is quite very common in our sub-Saharan African setting, and the longer the duration on oxygen. ROP develops in a consequential way. If we find it as stage 1 and we treat it, we would have avoided the other stages that would have come in a short-term bit, meaning some few weeks from the time you've diagnosed. So stage 1 could also heal on its own when the baby is breastfed well and they are not really in the hospital setting. But if it goes to stage 2 and stage 3, these need treatment. And now those are the main fears in ROP, because they can easily progress to stage 4, which means detachment, or can I say pulling away of the retina from its back. Retina is the back of the eye that sees that where the image is formed. So if we reach stage 4, we can't treat it in Uganda yet. We have to take the baby to India or to Kenya. You could also have squints, which in Uganda it's endali, when the eyes cross. That is also one of the consequences of prematurity generally, but also due to ROP. If one eye had a higher stage than the other, even a lazy eye, which we call amblyopia. And another is sometimes they could need, if at all they didn't get the blindness, but they had milder stages of ROP, they could need very high power glasses to see objects that are far, which is called high myopia. Those are kind of different, but it doesn't mean each baby can have all of them. It depends on what stage the baby had and was it treated. Yeah. So I would thank Mama Tuli organization firstly in this, because in the past 4 months, Mama Tuli has helped and facilitated our ability to screen about 50 babies under Mama Tuli as, can I say, custody. So in different centers around Kampala and its metropolitan neighbors. Amongst them, 10 were treated timely for retinopathy of prematurity, and when they were reviewed, their retinopathy of prematurity had resolved. So these are still young because this is within 4 months, but when we follow them up, obviously they will be having very good visual prognosis, because it was seen at an early stage, earlier than stage 3, and that was treated quite in time. And on screening again, that is reviewed, we were seeing resolved ROP features. So these are babies who would have been blinded in the long-term consequences. But because they were intervened in time, they were treated in time, so the ROP has resolved, and we hope and pray for the best that they will be seeing very well. And that obviously is a good thing in terms of their potential in life. But firstly, it's partnership that I'll call for organizations like Mama Tulia and its partners. And this shouldn't be done in only Kampala. We should be helped with Mama Tulia to spread in the whole country, because there's some smaller centers that also care for neonatal babies in the upcountry areas but have never even heard what ROP is in their ears. Yet I've seen some, and Mama Tulia helped one who came from far, far away, deep in an upcountry area, and came with already stage 5. But Mama Tulia helped to identify them and give them even transport back and counseling and guidance. That okay, it had already happened, but now the cry is early intervention. Because now Mama Tulia's ability is to know where those niches are and to be helped to bring the specialist in that area timely to screen and then timely to help in treatment.